Welcome to week one of this online course. The focus of this week's module will be to provide you with the basic definition of evidence-based practice and evidence-based medicine, and maybe give you a little bit of history behind how evidence-based medicine started and where it began and where it was being practiced, and then to lay basically the foundation for you guys as it relates to forming an evidence-based clinical question that may be used to drive your capstone and or thesis project while you're here at Point Loma Nazarene University. We hope that by the time you complete this module, that you'd be able to at least develop and maybe even create an answerable clinical question, and that you would be able to understand the importance and value of evidence-based practice across all allied healthcare professions. So the first place we start really is with Dr. David Sackett. Dr. David Sackett was an American-Canadian medical doctor who practiced mainly in Canada, but is also responsible for creating the Oxford Center for Evidence-Based Medicine. He was one of the first medical doctors to truly start the practice of evidence-based medicine. And so the definition of evidence-based medicine begins with Dr. Sackett, and he defines evidence-based medicine as this conscientious, explicit, and judicious use of the current best evidence. And so by current, what we mean by current is research articles that have been published within the last 3 to 5 years, and that you would use this current evidence in making your clinical decisions, and that those clinical decisions then would hopefully help improve patient outcomes, right? And so when we practice evidence-based medicine, what that means is that we integrate our clinical expertise or the clinical expertise of our peers and our colleagues, and we couple that clinical expertise with the best available clinical evidence, and we do that through systematic research, right, where we are rigorously searching through all of the literature that might be published, and then we're assessing that literature, right, to determine whether or not it can be used or we can use it to drive our clinical practice and to treat our patients. So again, Dr. Sackett provides us with this definition of evidence-based medicine that really encompasses different components to it, and we'll talk about that on the next slide. So when we look at evidence-based practice, what we see is that evidence-based practice is really in the center of it all, but it begins honestly with this notion of clinical expertise. And so what does it mean when someone says clinical expertise, right? And basically, that kind of refers to you as the clinician, your accumulated experience, your clinical skills, but it also refers to how educated you are, right? So not only do we look at the clinical skills, not only do we look at your years of experience, but we're also looking at whether or not you're able or capable of searching the literature, right, and applying that literature to either the patients or the clients that you might be working with. But then in the center, again, we have evidence-based practice, and then on the right and left side of evidence-based practice, you also have two other facets, right? And so I'll go to the left first, and we'll talk about the best research available, right? So what's that mean? It's this idea that we're taking the most current, best research articles, and then we're reading those articles and we're assessing their strength of recommendation, and we're deciding whether or not we truly can use the recommendations within these articles and apply these to our clinical population, right? And then there's this other category on this side that probably gets overlooked most often, and that really has to do with things from the patient's perspective, right? So patient values and preferences, right? And so what that brings to mind is really, what does the patient feel? What are the patient's concerns? What are the patient's expectations? And then again, what values does the patient have? Does the patient want to get better? Are they on workman's comp and they don't want to go back to work? So we have to also look, when we look at evidence-based practice, yes, it's important how many years of experience we have. It's definitely important to research, find the best evidence available, and apply that to our patients. But then we also have to keep in mind or really consider how our patients feel and take their concerns as we start to treat them and as we start to use evidence-based medicine in our practice. So the process of evidence-based practice really has 5 steps, and it really begins with the patient, right? So if I could draw something in here, what I would say is that it begins with a patient walking into our clinic, coming into our facility, right? And that patient comes into our facility either with an injury, with maybe a goal to gain strength or to lose weight, or to run further, right? And so then that's where the steps of evidence-based practice come in. That patient comes in, and right away you start to ask certain questions. You know, how did this happen? How can I get this patient to lose weight quickly? How can I return this patient to play quickly, right? So that's where we start to ask clinical questions. So the process of evidence-based practice begins with your ability to ask clinical questions. And I would say to ask a really good answerable clinical question. So that would be step 1. And then step 2 in that process would then be to search the literature, and then to weed through the lower evidence research articles and truly obtain the higher quality research articles. And then once you've acquired those research articles, then it becomes important to do what we call appraise the evidence, right? And so that's when we really look at the research articles with a critical eye. How many patients did they have? Was it just a one patient case study? Was it a cohort study where they only had 3 to 5 patients? Or was it one of the higher quality studies like a randomized control trial or a systematic review? And then once we appraise the literature, then the next thing would be to apply that research to our patient, right? And then once we've applied the research, whether that be some suggested rehab protocol, some suggested method for weight loss or strength gain, right? Then what we're going to do is assess, and I would say reassess, the effectiveness of the treatment and whether or not the evidence-based medicine process was effective at improving patient outcomes or meeting the goal for that particular patient. So if we go back to this slide and we look at evidence-based practice as being the center of these 3 components, what we would really say is that the full integration of these 3 components into clinical decisions really enhances the opportunity for optimal clinical outcomes and improves, hopefully, your patient's quality of life. The practice of evidence-based practice is usually triggered by what we would say is patient encounters, right, or client encounters, which generate questions about the effects of either a therapy, a diagnostic test, prognosis of disease, and maybe even some type of etiology of a specific disorder, right? So this might be a season where all of, let's say, your basketball players have suffer from ACL ruptures, right? And the clinical question might be, well, why is it that in a group of college athletes do we see so many ACL ruptures during basketball season, right? That might be the clinical question that you'd want to answer. I think it's also important to keep in mind that evidence-based practice requires different and I would say new skills of a clinician, including your ability to truly and efficiently search the literature and then to really appraise that literature and to determine of that literature that you found, which literature really truly is going to help you with the patient that's sitting in front of you, and more importantly, which research articles are really going to help you improve your patient outcomes and meet your patient goals. So the goal of, again, this week's module really truly is to help you create and develop an answerable clinical question, because that's where evidence-based medicine starts. And then hopefully to help you understand the value of evidence-based practice in allied health care. Looking forward to going through this online course with you and completing the week 1 module.